Is spotting or bleeding always a sign of miscarriage? So the short answer to it is no. But we need to look into the details. Why the spotting or bleeding happens in pregnancy? So it depends upon which part or which trimester of pregnancy the spotting or bleeding is happening. Early pregnancy, first 3 months are considered very crucial. So any spotting or bleeding in these 3 months raises suspicion in the mind of the patient, making the patient very anxious that they might have a miscarriage. So first trimester spotting or bleeding is different from second or mid-trimester spotting bleeding and the last trimester spotting bleeding. Especially in the last trimester, when some spotting bleeding occurs near to the date of delivery, most of the times it is of no concern but can be the beginning of the labor pains or delivery pains. So what the patient is supposed to do is immediately visit the doctor and get evaluated. Mid-trimester bleeding or spotting can be because of low-lying placenta or also can be related to the risk of miscarriages or infections. So even this spotting or bleeding requires immediate evaluation by the doctor. Now coming to the first trimester spotting bleeding, where the patients are most anxious. So first trimester spotting or bleeding may happen because of multiple reasons. First and most important common physiological reason is implantation bleeding. So what is implantation bleeding is when the pregnancy is trying to implant, it tries to invade into the layer of the uterus, which can lead to very minute amount of fresh red colored blood seen either on the panty or in the wipes which are used to clean the private parts. So this much very small quantity red colored blood without any abdominal or back pain is usually related to the implantation related spotting. Most of the times implantation related spotting will not repeat itself and will be stopped after 1 or 2 incidences. Now coming to the other causes of spotting or bleeding in first trimester. Other causes can be miscarriage or it can be ectopic pregnancy, both of which require immediate evaluation. Third important cause can be related to the deficiency of progesterone hormone. Now coming to each one by one. Miscarriages can lead to spotting or bleeding if the baby starts separating from the uterus. In that case, it will not be spotting but proper bleeding with red colored or black colored blood with sometimes even passage of clots. Sometimes subchorionic bleeding also can be presenting itself as spotting or bleeding, but pregnancy usually advances and the subchorionic bleeding will get absorbed in the body without affecting the baby. If subchorionic hematoma is very large, it may lead to increased risk for miscarriages and infections. So how do we diagnose subchorionic hematoma or miscarriage? Immediately after having this bleeding episode, you should consult your doctor. Doctor usually performs a transvaginal ultrasound to find out about the pregnancy and its viability. Also checks for the subchorionic bleeding or even ectopic pregnancy. So this first trimester scan after the bleeding episode is very important to rule out ectopic pregnancy, to rule out subchorionic hematoma and to rule out miscarriage. So scan and physical examination on speculum are the most important evaluation that the doctor does to give you the reason for spotting or bleeding. Usually these kinds of bleeding are associated with abdominal cramps or lower back pain. Also after this episode and evaluation, doctor usually will advise you some medications. There can be medications in the form of progesterone supplements or it can be medications to cause clotting of the blood so that you don't continue bleeding, or there can be some different kinds of treatments based on what is the reason for the bleeding. If it is related to the ectopic pregnancy means the pregnancy which is outside of the uterus. Ectopic pregnancy can be at any site other than the cavity of the uterus. Most commonly it is in the tubes, but it can also be in the ovary, it can be in the cervix, or it can be in the previous cesarean scar. Based on where the ectopic pregnancy is located, the amount of the bleeding or the symptoms will be decided. So if somebody is having ectopic pregnancy in the tubes, most of the times the bleeding or spotting is very minimal, but patient may have a fainting episode or have dizziness because of the bleeding which is happening internally. So in such cases, if the bleeding is associated with fainting episode or dizziness, immediately you have to rush to the emergency department of the hospital and get yourself evaluated. If the ectopic pregnancy is located in the cervix or previous cesarean scan, then the amount of bleeding can be on the higher side. In any case, the different ectopic pregnancy needs to be managed, sometimes with surgery or sometimes even with medications, and requires proper assessment and doctor's advice. So this was about different causes of bleeding or spotting in the pregnancy. I hope this was helpful.